who will share her powerful personal journey during her mission moment, and Dr. Portillo, Dr. Jessica Portillo, a family medicine specialist who will provide medical insights for our session today. Just a little bit more about Mel. She's a courageous breast cancer survivor who will share her personal experience. Her story is one of resilience, strength, and hope. Dr. Portillo received her medical degree from the University of Chicago's Pritzker School of Medicine. She joined Saban Community Clinic in August of 22 and currently practices at our Virgil Family Health Center. Her specialties include primary care and family medicine, obstetrics and senior care, women's health, including pre- and postnatal care, pediatrics, and LGBTQ plus care. She is passionate about full spectrum family medicine and committed to serving diverse populations. She chose Saban because of its mission to provide quality care for all, regardless of your background, income, or circumstance. So welcome, ladies. Thank you for joining me today. So to kick us off, let's start with our mission moment. And we'll start with you, Mel, if you don't mind sharing your personal journey of why we're here today. Thank you.
Thanks, Jackie, for the introduction. And hi, everybody. Thanks for taking the time out to join. Breast cancer is on the rise to younger women, as Jackie shared, and I am one of them. Tomorrow is actually 2 years of me finding out that I was diagnosed with triple negative breast cancer at 39 years old. I felt a lump, and like many people, I was kind of like, oh, what's that, during my self-exam, and I didn't think too much of it. I thought maybe it was hormones. It was right around my period, so I didn't get overly concerned. And during my next month's self-exam, I noticed that the lump was still there and slightly bigger. I am fortunate that my mother is a retired physician, so I first made her feel my lump, and she said, get into a doctor. So I made my appointment, and a couple days later, my doctor felt it. She was not overly concerned from feeling it at first. She was kind of like, you're close to 40 years old, you're close to mammogram age, we're going to get you in. I don't want to stress you out. It could be benign, it could be a cyst, there could be many reasons you have a lump, but you're going in for your first mammogram. And right off the bat, I'm going to get you an ultrasound as well. An ultrasound is usually recommended for those women with dense breasts that doctors can often feel, and they can also show up on the mammograms when you have dense breasts. So went in, did that, and my next option was my next thing recommended that I get a core needle biopsy. And going into that, I was kind of like, oh, what am I going to do? How is this going to feel? I was a little scared. Some people that I had known told me like, oh, you can watch it on YouTube, but others were saying, don't do that because it could get a little scary. I chose not to. So I went in not knowing what exactly was going to happen, and they stuck the needle in the tumor. And I did have a bit of a cut and everything there because it was a large needle to grab some cells from the tumor. And about 5 days later, on my older brother's birthday, I was diagnosed with breast cancer. At that time, they did not know what type of breast cancer. They were still running all the tests. And it was really tough for me because not only was it my older brother's birthday, I'm finding out I have breast cancer, but my sister-in-law, my brother's wife, had just beat breast cancer about 3.5 years prior. So I had to tell him, sorry, I'm telling you on your birthday, while also your wife just beat this. I had no family history other than in-laws and not blood. And it was really hard to take it. A couple days later, I learned that it was not positive for some of the hormones. And then a couple days later, I eventually learned that it was triple negative breast cancer. Triple negative breast cancer does tend to impact women younger of age, and it is a aggressive type of cancer. Because it's not hormone related, the best course of action is treatment, surgery, for treatment would be chemotherapy, surgery, potentially radiation, just kind of depending on what you wanted to go down and what works best for you and your doctors. So I started chemotherapy in September, the first week of September. I decided to get an intravenous port inserted into me. So I know it's a little bit hard, but you might be able to see my scar. So the port gets inserted there, goes under the skin, but it's an easier way that they are then to put in all of the medicine going through there rather than needing to poke me with a needle every week. Got that done. Went through one round of chemo and an immunotherapy drug, and unfortunately, I had some adverse reactions to the immunotherapy drug, so I had to stop that. I started steroids to get that out of my system. Went into additional chemo drugs because the original plan was I would do 16 rounds of chemo, two drugs with 12 rounds, and two drugs with 4 rounds. After that immunotherapy, we switched to the two drugs that I needed the 4 rounds with. I started losing my hair. I started gaining weight. I wanted to eat everything in sight rather than not eat. And so many people think of chemotherapy patients as they lose weight, they look frail, and that's really not the case. It really does vary for everybody. And so people were telling me, oh, you don't look sick. And I'm like, oh, trust me, I am sick. I don't feel well. And I think that's one of the biggest things of anybody going through cancer is those around you don't fully understand what you're going through, but they also have this impression that cancer makes everybody look the same way, which is not the case at all. I got through those 4 rounds of chemo and I went back to the first chemo drug that I had with the immunotherapy drug. And unfortunately, I had an allergic reaction to it. That drug and me just did not get along. I went into anaphylactic shock. I was sent to an observation room and my case went to the tumor board. So the tumor board is specialized surgeons and oncologists that will meet and discuss unique cases that they might need some extra insight with. And my doctors decided to move my surgery up to get the cancer out of me first before continuing with any of the other treatment. So moved up my surgery, ended up doing what they call a lumpectomy, which is a partial mastectomy. They removed just the tumor from my breast, but then also gave me a lift to be able to adjust and not have a hole where the tumor was. There are different surgery options available for people. There's also the option to go completely flat, and every option is totally dependent upon what you want and your lifestyle, and there's no wrong answer. So I did the lumpectomy and I went back onto chemotherapy. I was able to get through 9 rounds of that chemotherapy, so not everything. I then did radiation for 20 rounds, and radiation was daily, Monday through Friday, so every weekday. And I would lay there. I had to lay perfectly still for about 20 minutes every day as this was basically lasers were beaming at me. I couldn't even look at them. I was laying down. And I remember on my last day, I asked, I'm like, can I record this? Because I have no idea what this looks like. My tech actually let me set up my phone and record the entire session. I have not watched all of it, but it was nice that I was able to see it. And then I did an oral chemotherapy after that. So the oral chemotherapy was a special pill that I got from a specialized pharmacy, and it came with its own set of side effects. At one point, some of my side effects for this was the entire bottom of my feet were blisters, and I could not even walk a mile. And it was all very challenging, everything on my body. And now, again, not even officially 2 years from being diagnosed, I finished all of my treatment early December 2024. I have already run 2 half marathons. Since then, I have come back to work full time, and I actually worked through all of it except for surgery. My hair has grown back. I never had curls. Jackie knew me before this. My hair was straight, so that is a side effect that did not know would happen, and I'm not mad at that one. Don't like any of the other side effects that I had. But I'm really here to say, make sure you do your self exams, make sure you know your body, whether it is once a month, once a week. The recommendation is once a month. And I say once a week because maybe it is your time of month and you feel it could be wrong and it could be a hormone thing. So check it and then check it the following week. There's no wrong thing to check it more than once. If you need a reminder, a fun little reminder to remember to check your breast is feel it on the first. On the first of the month, I know we have a lot of bills that are tend to be due on the first of the month. And so just consider it another bill. It's something that you just end up having to be able to do, but you get in that routine and then you know to feel it on the first. And so for breast cancer, again, there's several different types. Not everybody gets all of the chemotherapy that I did. It depends on what type of breast cancer you get. Some after the surgery and or after chemo, you can get additional drugs for hormone suppressants. As triple negative, I can't. Instead, I get routine screens now. I'm still getting blood work every 3 months. I'm getting a mammogram once a year, but I'm getting an MRI once a year as well. And I alternate between the two. I see my cancer surgeon every 6 months. I see my radiation oncologist every 6 months, and my medical oncologist with my blood work every 3 weeks. The type of chemo that I had also can cause long-term heart health issues. So I do have a cardiologist now that I see, and I see her once a year. The immunotherapy clouded up my lungs. So I was seeing a lung specialist, a pulmonologist. Now that I've already been cleared for, and he was very proud I was able to run my half marathons. And I've also am now seeing an ophthalmologist because unfortunately the chemo caused something where my left eye will randomly cry. So I won't know it's crying until it's down my cheek. So it's just some odd side effects that you don't even think about. Again, most people think of chemo patients, they end up losing weight and they look frail and possibly sick, but there is such a wide variety out there. So it's really about trying to just get through it, stay positive, and know your body and work with your doctors because everything that I had, I would tell my doctors, and they could either prescribe me medicine for the pain. I didn't have nausea. They prescribed me medicine for nausea. I didn't end up needing it. But there's so many resources out there, as well as the preventative resources. And I know Dr. Portillo is going to be able to share a little bit more about that. So wanted to now pause and see if there's any specific questions for me. I know we'll have questions at the end though, too.
Okay. All right. Thank you, Mel. That was an incredible journey. Did not know about the blisters, the random crying, and all the number of specialists that you are still continuing to see. You're absolutely correct. Looking in or just really see cancer as a very one-dimensional disease, and expect everyone to have that same experience. So thank you for sharing the diversity of cancer, and your experience. And again, congratulations on
Thank you.
surviving, thriving, to still, come back at it. It's 2 years and you are running, right? You're doing your half marathons. So I just love hearing your story. For those just a little background, Mel and I met in a run club. So she's a dedicated runner. I have stopped running, but she's she's the fighter, right? So thank you again, Mel. And please, we'll definitely take more questions after Dr. Portillo's presentation. But I'm going to transition to Dr. Portillo to kind of go over things and signs to look for and break down exactly what breast cancer is. As Mel described, there's multiple types, there's different ways that your body will be impacted. So let me pull up your presentation and we'll get started, Dr. Portillo.
Thank you.
Yeah.
Dr. Portillo, while she's pulling up the slides, would you mind just saying once again how to access the translation? Because I know we had a lot of people join within the last few minutes. So
Sure, of course. Buenas tardes a todas las que hablan o hablan español. Si necesitan la interpretación en español, si chequean el lado bajo de la pantalla, hay un traqueo con un globito que dice interpretación. Háganle clic ahí y seleccionen el lenguaje de español.
Great. Okay, I'm pulling up your slides now.
Great. Thank you, Jackie.
Mhm.
All right, I'm going to give a brief overview of what breast cancer is, and we'll address some questions at the end. I just wanted to give everybody a little bit of a better sense about this disease. All right, so breast cancer is considered an abnormal growth of the cells that we have within our breasts, and that abnormal growth becoming malignant tumors, as you can see in this picture here. There are many different things that can cause breast cancer, or many different factors that contribute to the development of breast cancer, one of them being genetic factors. And by that, we mean either family history. So if you have a first-degree relative, so that is either a mother, a sister, a daughter, or a father with breast cancer, that makes you twice as likely to develop breast cancer as someone who does not have a family history of breast cancer. There are many different types of genetic mutations that also predispose you or make you more likely to develop breast cancer, which sometimes runs along family lines. The most common ones are the BRCA1 and the BRCA2 genes. They are commonly found in certain types of ethnic groups, especially Ashkenazi Jewish people or people with that heritage. Other factors include hormonal factors. Mel kind of alluded to this being a cause of breast cancer earlier. So hormones, especially estrogen and progesterone, can contribute to the development of breast cancer. Some hormonal factors that make you more likely to develop breast cancer are if you developed your menarche or you started menstruating before the age of 12, that exposes you to more estrogen and progesterone in your life. If you underwent menopause later in life, so after age 55, once again, that prolongs your exposure to estrogen and progesterone. That also makes you more likely to develop breast cancer, as well as if you had your first pregnancy after age 30, or if you've never been pregnant in your life. Once again, that's because of the prolonged exposure to hormones in your life. Women who are use hormone replacement therapy as well after menopause for prolonged periods of time also can be higher risk for breast cancer, and that usually means for more than 10 years. Certain lifestyle factors can also make you more likely to develop breast cancer, and those include obesity, physical inactivity, and that's due to the fact that excessive fat cells in our body can also produce some of these hormones, alcohol consumption, as well as tobacco use. Some environmental exposures can also make you more likely to develop breast cancer. So if you've ever had radiation exposure to the chest, and that can be from your job, for example, like if you're a radiation technician, if you've ever had other types of cancers that require radiation therapy, thyroid cancer is a common one. And then women who've been exposed to certain medications. A common one that we don't see nowadays was DES, which is a medication that was used in the 1940s and 1970s to prevent miscarriages. So women who were born to mothers who use that medication are higher risk for breast cancer. Great. There are many different types of breast cancer, but I'll go over the most common ones. So the most common type of breast cancer is invasive infiltrating ductal carcinoma. And this is the type of cancer that spreads from the milk ducts in our breasts to the surrounding tissue. It accounts for about 80% of all cases of breast cancer in females. And it is also the most common male breast cancer. The second most common is lobular breast cancer, and this is cancer that has spread from the lobules, the milk-producing glands, to the surrounding tissue. So both of these are cancers that can spread. And then the third kind is ductal carcinoma in situ, and in situ just means in one location. So it's a non-invasive cancer within the milk ducts. It's a type of cancer that develops in the milk ducts and stays in the milk ducts. This is the highest percentage of new diagnoses that we're seeing. And it's due to increased screening in younger women as well. All right, so who gets breast cancer? A very common question. So 99% of cases are in females, or women who were born, or people who were born as a female, and less than 1% of cases are diagnosed in males. 50% of women are diagnosed between the age 62 or younger, although we are seeing a rise in younger women, as we discussed earlier. And then 50% of women diagnosed have a family history of breast cancer, so kind of the highest percentage. And as you can see, it affects women of all races and ethnicities. In the United States, we have the highest rate in white women. And I think this is also partially due to increased screening in this population. And we do have the lowest rate in Hispanic women, which may also be due to screening, but also due to other environmental factors, such as number of pregnancies, like we discussed earlier, as well. And so, but it affects everybody. So some further statistics we have in the United States are that breast cancer overall is the second most common cancer in women. So 1 in 8 women will develop breast cancer in their lifetime in the United States. 60% of breast cancers are diagnosed at a localized stage. So that means at a stage before it spreads to other tissues, which is great because it increases our chances of being able to treat it, and it increases the 5-year survival rate to 99%. That means that 5 years after your diagnosis of breast cancer, you are alive and well. And so the 5-year relative survival rate for all different types of breast cancer is 91%, which in terms of cancer rates is pretty good. We'd obviously love to see that as high as 99%, but I think there's a lot of research, there's a lot of interest in breast cancer, and I am hopeful that in the next couple of decades, we might see this number go up as well. And there are approximately 42,000 women in the United States right now who will die from breast cancer, unfortunately, in 2025. So that is a high number. And our goal is to really bring that number down. But the nice thing is that we have over 4 million women in the United States, like Mel, who are breast cancer survivors. So, you know, although we're seeing these high rates, we are doing a great job with catching it early, with treating, and, you know, helping these women live long, healthy lives afterwards. So there are many different ways that breast cancer can manifest, but one thing to note is that early stages are usually asymptomatic. So most women don't know they have breast cancer, and the only way for us to know is to catch it on their screening mammograms, which we'll get to in a little bit. But there are some symptoms we can be on the lookout for that can indicate that there is a concern for some type of abnormality going on in your breasts. As Mel alluded to, one of the most common findings among women is that they feel a lump. So they feel like a hard mass in their breast that wasn't there before. Another symptom can be nipple discharge. So either having a bloody discharge from the nipples, a milky discharge, or a watery discharge in women who are not lactating or not breastfeeding. Feeling an area of swelling, so like a piece of tissue that's a little bit more inflamed than other sides, a piece of tissue that's warm or red, or you may notice that your skin is darkening on just one specific area of the breast and the rest of the breast looks normal. Other symptoms can be feeling or noticing a puckering in the breast. So where it feels like your breast is being pulled in from the inside, that is not normal. As well as noticing some itching or scaling or a rash on the nipple compared to the other nipple. When it's usually one-sided, that's when we consider it an abnormality. It can still be both-sided, but any abnormal findings on just one breast should prompt you to see your doctor. Another common symptom is noticing that one of your breasts is just getting larger than the other, right? That is not normal. So that's another sign that we should be seeing our doctor to get further evaluation for this. So how do we screen for breast cancer? So the most common way is through a screening mammogram. And so a mammogram is a specialized X-ray machine, kind of like you're seeing here. It is not the most comfortable procedure, but it is quick. And it takes 2 X-ray plates and they squish your breasts between them. and they run x-rays through that to see the tissue. So that is step one. For women who have any type of abnormality, so if you come to your doctor and you say, I felt a mass or this looks abnormal on my breast, a screening mammogram is not for you, right? A screening mammogram is just for women who have no symptoms, right? And we'll talk a little bit about who should start to get their screening mammograms. For women who have a concern on their breast, what we do is we order a diagnostic mammogram, which is similar to the screening mammogram, except it takes more pictures and focuses more on the area that's abnormal. And that is followed by a dedicated breast ultrasound. And the reason we do both is because sometimes when women have dense breasts, like you cannot see enough with the x-ray. And so you need an ultrasound to look further to make sure that you're catching anything that the x-ray missed. So those are the two most common modalities. For higher risk women, we do also use breast MRI. It's not as commonly used right now, and usually one of the reasons we don't use it is because of the cost. And any abnormality that's suspicious for cancer will be followed up with a biopsy. Another way we can catch any abnormalities is through a breast exam. Either a self breast exam that you do yourself or one that you get done by your doctor in clinic. So as Mel said, we recommend you do your own breast exam at least once a month. For women who are still menstruating, the best time to do it is about 5 days after your period starts. This is when your breasts are the least lumpy and you're less likely to have tenderness from the hormone changes. For women who have gone through menopause, you can do it at any point in the month that works for you. There are two ways to do it. One is you can do it lying down, like in the picture, with your arm up, or the other way is you can do it standing. If you do it standing, one of the easiest ways to do it is in the shower. You can put some soap on, and that helps lubricate the breast, and then you can run your hands down. The goal is to touch every single part of the breast with gentle and then deep pressure to check for any changes that you may feel. And as kind of Mel alluded to, any change that lasts more than a month or is growing is a cause for concern, and you should see your doctor right away. All right, so who could be screened for breast cancer? Number one is anybody who has a symptom, right? If you see anything abnormal on your breast, it doesn't matter if you're 20 years old or you're 70 years old, you should go into your doctor to get double checked, and they can tell you whether it's concerning enough to get further evaluation. But in terms of women who don't have any symptoms, average risk women, that means women without any risk factors, no family history, you should start getting your screening mammograms done at age 40. We recommend getting them done every 1 to 2 years until the age of 75. And then you should do your clinical breast exam starting at age 25. For women who don't have any risk factors, you can get your clinical breast exam with your doctor every 3 years. And then for women over the age of 40, recommend you do it every year with your physical exam. In higher risk women, for example, women who have a family history of breast cancer or increased risk factors, we recommend a mammogram and a breast MRI every year starting at age 25 to 40. So typically women who have a family history of breast cancer, we start your screenings 10 years before your relative had breast cancer. So for example, if a patient comes in and her mom developed breast cancer at age 40, we would start her screenings at age 30. And then they should be getting a clinical breast exam every 6 to 12 months, starting at age 25. And like I said, for any symptomatic woman, women who are younger than age 30, we usually don't do a mammogram with x-ray. We just do the ultrasound because younger women have denser breasts, meaning breasts with more fatty tissue in it, which makes the deeper tissue harder to see on x-ray, but easier to see on ultrasound. So we just do a screening ultrasound. For any woman over the age of 30, we do both the mammogram, the diagnostic mammogram, and an ultrasound. And depending on the results, we may follow that up with a breast MRI if needed.
Great. Thank you so much, Dr. Portillo. Let's stop my share. Okay. It stopped. Okay. Wonderful. Thank you, Mel. Thank you, Dr. Portillo. This was a great, great start of this conversation. We do want to open up to the audience. If anyone has any questions, go ahead to either unmute yourself or add them into the chat. Oh, I see a hand is raised. Go ahead, Maria.
Sí, yo quería preguntar, el tratamiento antes del cáncer, cuando ya está diagnosticado, antes de que se haga la primera quimioterapia, durante el cáncer, durante el tratamiento y después del tratamiento, ¿qué dieta debe seguirse? ¿Hay una dieta por régimen? ¿Qué es lo que no se debe comer o qué es lo que se debe de comer o alimentarse uno para no estar tan débil durante el tratamiento?
Ok, voy a interpretar para que todos entiendan la pregunta. So gracias por la pregunta. I'll interpret the question. So Maria would like to know if there are any dietary recommendations for pre-chemotherapy and post-chemotherapy to keep people healthy and strong during their treatment.
That's a great question. Dr. Portillo, do you want to?
Yeah, I'll say it in Spanish and then I'll say it in English. So mi recomendación es una dieta balanceada y saludable. Y tu oncólogo también va a hacer diferentes estudios para chequear niveles de sangre y vitaminas y posiblemente recomienden otros tratamientos en adición a una dieta saludable. Pero en general eso es lo que recomendamos. Y tal vez Mel tiene más información sobre eso. So I just recommended a healthy, balanced diet overall, and then working with your medical oncology team to see if there's any other supplementation you need based on your labs that they will do. But I don't know if Mel wanted to jump in with her recommendations.
Definitely. So while I was going through chemo, I wanted to eat everything unhealthy in sight. Give me all the fries, all of the potato chips, fried rice, everything. And my oncology team was okay with that because they just wanted to make sure I ate. So many patients don't eat. For example, my sister-in-law, everything made her nauseous. Everything gave her heartburn. That at points she actually needed to be force-fed even just peanut butter and almond butter because she couldn't keep anything down. And so it's really working with your medical team of what will be best for you. My team was quite okay that I did not want to have leafy greens at that point in time. Now, after my chemo, I ate a lot more salads than I ever did. I ate salads and vegetables before, but to make it a point to get enough leafy greens and different vegetables, I eat a version of a salad almost every day now for lunch. I still eat burgers, I still eat fries, but I eat them less often than what I did before cancer and during chemo. So it's definitely more balanced now.
And I will say also for patients with estrogen positive breast cancer, there are more restrictions. There are certain foods that can promote estrogen production, like tofu, things like edamame, anything with soy, will likely be you will be told to remove that from your diet.
I was also told be cautious, not that I couldn't eat red meat or I couldn't eat deli meat, but just really limit that. So I still eat red meat, but I try to avoid deli meat as much as possible. Any processed meat is considered a carcinogen, which can increase your risk with cancer. It's not the sole reason why you would get cancer, so it's okay if you eat it. But they did say, you know, be cautious about eating the deli meat, frozen meat, so even frozen chicken tenders. All of that, just be cautious and try to limit. And so for me right now, I eat very little of that. And it's versus before, it's not like I ate it every night, but I always say there would be some nights I got home from work and I ate like a child because I wanted those frozen chicken tenders. And now I just don't keep them in my fridge or freezer.
Oof, that'll be hard.
Yeah.
So, I'm not sure. Angel, do you have a question? You want to put yourself, you want to go off mute? I understand the difficulties. Okay, you're good?
We
Okay.
can't hear you yet.
Yeah.
Can you
There
hear
you
me
go.
now?
Yes.
Okay. First of all, Melissa, thank you for your story. It's very inspiring and encouraging to make me get my behind in there and get tested. I am 53 and I've never had a mammogram, and I'm afraid. My grandmother died of breast cancer and lung cancer.
Mm.
So I need to make an appointment. I guess I'll have to call Saban. But anyway, I'm
I'll
very
put the number in the
nervous.
chat.
I'm very nervous. So, but I do have to schedule an appointment for one. I missed it.
I will say it is nerve-wracking. I remember going into mine and it was my first one and getting told I was getting the diagnostic one because I felt the lump, as Dr. Portillo explained. And I wasn't sleeping well because it was, I don't know what this is going to come back with. But
Okay.
now I get them often and it's still scary, but at least I know what I'm going to be going through now, and it's not as bad, and it's needed.
And excuse me, can I interject for 1 second?
Mhm.
Part of the reason why I didn't go is because yes, it is nerve wracking, and when you become complacent and you're stagnant, sometimes you don't even care about going to your doctor's appointments.
Mhm.
And I feel so bad for not going, but it's like when you're put in a position where other people don't care, it's almost like, what the heck difference does it make? Every time I go to Saban, there's a different doctor. I just want somebody to stay there that I can be comfortable with, like I was with Dr. Young. So whoever I see soon, I want them to stay. They move around too much. And I suffer from bipolar, severe depression, blah, blah, blah. I will sit here in my bed and I will not get up and go to my doctor's appointment. I will be like, F it. You know what I'm
Mm.
saying? So it has a lot to do with my mental and my physical ailments, why I did not go. But I need to be able to get my behind up and make myself go.
We'd be happy to see you back at Saban.
Yes,
Definitely.
I'll be there.
Thank you, Angel. Thank you for sharing. And I hope that you get there to make that appointment. That
I
first mammogram is a little uncomfortable, but it's so important.
No, I'm gonna do it because my son's always worried about me. Ma, did you go to your doctor's appointment? Did you do this? Da, 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 da. And I can't stand it, but I do lie and say yes, I went. But I better stop and I better go.
You know, definitely. Mel, I wanted to ask, having that diagnosis can be pretty triggering. How did you really navigate the initial shock? You're 39, you just got diagnosed with breast cancer, and then also having to make so many decisions about your care and what to do next. How did you navigate that?
For me, I think it was a bit different since my sister-in-law just
Mm,
went through it in 2020, and I got to see her go through it. Now, hers was during the global pandemic.
mm,
I couldn't go see her at the hospital. I couldn't be around much. They was very strict of who could go in, but I saw what she had been going through at least, and hanging out with her. So I think that helped me. I do remember that first night I got the diagnosis, I did not call my parents first. I didn't want to tell them. That was going to be so difficult for me. So I called my best friend and we never talk on the phone. We text nonstop. So when she saw me calling, she already answered with like a choked up because she knew something wasn't right since
mm,
I was calling. So when I got off the phone with her, I was like, I'm still not ready to call my parents. And I had to call another very close friend. Um, my best friend lives in Denver. My other basically other best friend is in Charlotte. So couldn't go see them in person.
mhm,
And then I was finally ready to call my parents who are down in Orange County. So I was not going to drive there. And it was really hard. It was also, I don't know who I want to tell yet. It kind of became, I don't want people feeling sorry for me. I'm very independent. I wanted to continue to be independent, but I also knew I'd need support. And in my place of work, I'm the one that helps everybody. So I also knew I'm not going to be able to be there and answer their questions. I don't know how I'm going to be feeling. I don't know if I'm going to need to take a leave from work. So I told coworkers before I told a lot of friends. And I do remember telling them like, hey, the women at least, we have a women's chat, and I said self breast exams work. And I know they work because I was diagnosed with cancer. And it kind of became, okay, this is how I'm going to navigate of tell people slowly and when I'm comfortable with it. In terms of choosing my care team, I asked my sister-in-law if she knew anybody. She stayed very close with her doctor, one of her doctors in Orange County, and her cancer surgeon was a fellow under my cancer surgeon here in LA. So that's how I got recommended to my cancer surgeon. And where I went for her, they have a comprehensive system. So she works with one oncologist, she works with one radiation oncologist. There's a couple of different plastic surgeons she works with. So I was able to meet with all of them. And it was the same appointment to meet with everybody. I stayed in the one room. They all came to me, and it was a 5-hour appointment.
Wow.
And by the time I got done with this appointment, I was like, exhausted and get me food. Like, this was information overload. I am over this. Like, can we just go get some food? And that's what my parents and I did. We went and got food, and it became, okay, this is when I'm starting my treatment. And I was, whatever the doctors tell me is going to be best. I didn't question, should I try this? Should I try that? It became, okay, I have triple negative, just like my sister-in-law did. I am going to go this chemo option. I'm going to do this. Like, there was no, like, should I do something else? Should I do this? Like, there was the questions about what I eat. There was the questions about how I can work out, but it wasn't second guessing any of the drugs that they were going to give me. And something that I will add, Dr. Portillo shared some of the stats there. So my sister-in-law is Mexican American and I'm Ashkenazi Jewish. And so both of us can have higher rates to have the BRCA gene. Both of us were negative for the BRCA gene when we did our genetic testing, and yet both of us still with triple negative breast cancer. And she found hers at 40 from her first mammogram. I found mine 39. And had I had a mammogram earlier, it possibly could have found when it was an earlier stage or maybe still DCIS, because when we did my surgery, they did find in the pathology report that there was DCIS, that also with the triple negative. And so that's why the early detectives.
What is DCIS?
Ductal cell carcinoma in situ. It's the localized one.
Oh, local. Okay.
Yeah. Sorry. So it stayed localized, but it was still, if DCIS, because that is localized, if you don't catch it early enough, that's when it can come into one of the others. So that's what we possibly think. We don't know for sure with me.
Oh, incredible.
But yeah, the mental state was one of the hardest things. I don't like to cry. And I, at one point, remember saying, just stop crying. Like, at this point, you have cancer. There's nothing else you can cry about. All what you got to do is go out there and beat it. Like, just, for me, it was the tough talk of stop effing crying. Like, get past this part.
That's a good segue to my next question. How can friends and family best support someone going through diagnosis treatment of breast cancer, would you say? And Dr. Portillo, you can join in as well.
I'll let Mel take the on that one.
Yeah. I will say be there for them, listen to them. Some don't want to open up during it, some do. It took me about 2 months to share with many people. And part of the reason why I finally decided to share was some people started to find out, and I was like, I want this to be my story. I don't want them to hear from other people. So I went social media public with it, and I was like, my story, this is how I'm sharing it. I have met several friends going through breast cancer. They chose not to share. So it was a small group. Everybody's different, so it's kind of be there for them, listen to them. Um, some people get kind of triggered by the words of like, you're a warrior, you're so brave. I didn't get those feelings. So it really depends on the person. I think the reason why some folks get triggered of saying to a cancer patient, you are so brave, it's you don't know, like you just have to fight. Of course you want to be brave. You don't need that reminder. But again, my mentality wasn't with that. So it varies on the people.
Great, great. Thank you. I see Maria. Did you have another question? Maria? Yeah, there she is.
Bueno, primeramente agradecer, ¿no? Lo que están haciendo ahorita. Yo soy sobreviviente de cáncer también. Hace un año atrás me dijeron que ya no tenía cáncer en mi cuerpo y le agradezco a Dios primeramente por la nueva oportunidad que tengo de sobreviviente. Y sí la entiendo a la señora, yo también fue una de ellas que me abrí en mis redes sociales también y expliqué lo que tenía y que me iba a retirar un poco de las redes sociales. A mí me animó mucho los talleres que tomé de salud mental y me ayudó mucho también los talleres de pintura, de maquillaje. Y en mi entorno, pues mis hijos, mi familia, mis 3 hijos y mi esposo me ayudaron mucho. Mis amistades también, amistades de lejos. Yo no soy de acá, soy de Perú, pero amistades que yo tenía en mis redes sociales, a veces cuando uno está, se puede decir, en la lona, muy decaída, siempre hay un ángel, digo yo, que te llama o te manda un texto y te anima y te ayuda a seguir adelante. Y como dice la señora, cuando dicen, eres una guerrera, para muchos a veces incomoda, pero hay que entender también a esas personas porque es su forma de darnos ánimos, la forma de que ellos en alguna parte buscan que nosotros estemos bien. Y gracias por este taller, porque muchas de las que estamos acá, familiares o pacientes, estamos queriendo saber más sobre esta enfermedad, ya que se ha vuelto muy común. Entonces, yo agradezco mucho a todos los médicos que me trataron, a todas las enfermeras, especialmente a la clínica, porque ahí fue donde yo me traté. Ahí fue donde me dieron el diagnóstico y de ahí me pasaron a los especialistas. Y le doy gracias a Dios sobre todo. Mi fe, lo natural y lo médico, la ciencia, fue la que realmente yo pienso que por eso estoy acá. Hay una misión todavía para mí en este lugar, entonces a seguir adelante y a las personas que no se abren, mis respetos también porque llevan, como decimos nosotros en nuestra cultura, la procesión se lleva por dentro, te pueden ver bien, pero realmente no saben cómo estás. Pero la pregunta de qué es lo que más podemos hacer los pacientes que ya estamos diagnosticados, que ya estamos en ese proceso, que es algo muy, muy bueno porque muchos repiten lo mismo, dicen, ella pudo, yo puedo, pero cada organismo es diferente, cada, cada cuerpo reacciona diferente a lo que está siendo tratada y pues solamente pongámosles mucha fe y dejemos que la ciencia haga su trabajo y lo natural también haga su trabajo, como ir a los campos, a la playa, sitios donde uno se puede relajar, se puede motivar para seguir adelante y con el cariño y el aprecio de la gente que nos quiere, de nuestros familiares que están alrededor de nosotros, podamos estar más tranquilas con esto, aunque siempre queda el temor, el miedo de que te pueda volver a dar, cómo vas a reaccionar, pero para eso estamos en algún momento, necesitarnos unos a otros y compartir nuestras experiencias. Y muchísimas gracias y bendiciones a la señora que compartió. Yo también tuve triple negativo, pero para lo que ella pasó, a lo que yo pasé, me doy cuenta que tenía razón mi oncólogo. No todos los cánceres puede ser el mismo diagnóstico, pero el tratamiento es diferente. Y eso hay que tomarlo muy en cuenta. Muchísimas gracias.
Gracias por compartir. I can try my best to translate that. She's very grateful for you sharing your story, Mel. She also has triple negative breast cancer and has been cancer-free for a year now. She's very grateful to Saban. This is her clinic and this is where she was diagnosed. And you know, she had a very different treatment experience than you. So she realizes that, you know, every body responds differently to the cancer and the treatments. You know, she, like you, also made her story public on social media. She's not from the United States. I believe she said she's from Peru. And so she has family and friends who are abroad. And so, you know, it was a great source of support for her to receive messages from family and friends, and it gave her a lot of hope in those difficult times. She also relied a lot on her mental health groups that she was part of to help her get through this very difficult journey of cancer and treatment. She's very spiritual, so relying on her spirituality was also something that was really important to her. And, you know, just looking to her community for support. One question she asked is, what can cancer survivors do to keep themselves up to date and, you know, make sure that any changes are caught early? Is the question I believe that she presented, because the fear is always that the cancer will return.
Thank you so much for that. Thank you, Maria, for your comments. And thank you, Dr. Portillo, for translating. We are just about at time. And I know I see a couple of other questions are coming through or came through the chat. But I do want to respect everyone's time, so we won't be able to get to all questions. But, you know, again, I just want to thank Melissa Korc for sharing your personal journey in our momentous speaker moment, and to Dr. Portillo for sharing your expertise and you know, breaking down breast cancer for us here today. I do want to remind everyone at the Saban Community Clinic, we do provide mammograms. In terms of access to those, we have a mobile mammography service that comes on site, as well as we can manage referrals for external services for that. So please, if you are 40 and over, make sure that you are scheduling your mammograms. If you're under 40, make sure you're doing your thorough self-exams, and everyone actually should be doing our own self-exams at least monthly, to just make sure we can check our health ourselves and follow through with our care teams. With that, Dr. Portillo, Mel, is there any final words you would like to leave the audience with today?
I just dropped it in the, oh, go ahead.
Yeah, no, thank everybody for coming. We are here at Saban for any medical concerns you need. And for our patients here today, please come in. We are happy to talk to you more about your breast health. Make sure you get all of your screenings done, and we will do your breast exams. We will schedule you for your mammograms.
And thank you everybody for joining. And remember, I feel it on the 1st. I dropped it in the chat. It's a great way to know your body.
Feel it on the 1st. Thank you, everyone.
Thank you.
And happy National Health Center Week.
Thank you.
Take care.
Thank you all. Have a beautiful day.
You too.
Bye-bye.